In today's health report, I had an opportunity to speak exclusively with Bill Gates, co-founder of Microsoft, and along with his wife Melinda, co-founders of the Bill and Melinda Gates Foundation, about the organization's polio initiatives in Africa and elsewhere. First, I asked his reaction to the latest polio outbreak in Nigeria.
Well, it was very exciting that we went 2 years without any cases, and the idea that there's this area up in the northeast of Nigeria around Lake Chad where we found these 2 cases, that's a disappointment. We were engaged in a very aggressive effort to get vaccines out to as many children as possible in that area and get the number back down to 0. We're quite optimistic we can do that, but we're really trying to understand how we do better surveillance so we don't have a pocket like this in the future.
So in light of this development, and when we look at the big picture, it is one thing to interrupt transmission. It is another thing to stay polio-free. So how does Africa sustain the hard-won gains in keeping polio at bay to be declared polio-free one day, really?
Well, the good news is that the intensity of the campaigns has been maintained. Nigeria at one point was over half the cases in the world, and many people said to us, can you really succeed in Nigeria? If we go and look at the level of immunization, even up in the north where the health systems are more challenging, we've got that at quite a high level. So if we can get rid of this pocket, then it'll cement the change. In parallel, we're still working in Pakistan and Afghanistan, and so we feel really good about where we are despite this setback. We've got a great team up there. The government's working with us. We need to access kids, and we need for people to understand the importance of getting all the kids to take this oral polio vaccine.
And you mentioned Pakistan and Afghanistan. So could you elaborate a little more on what the foundation is doing in these 2 countries that are still endemic, and also a country like Ukraine that witnessed an outbreak last September?
Yeah, fortunately, the Ukraine thing looks like it's under control. So both in Nigeria and in Pakistan, Afghanistan, our main challenge is that we have kids who the vaccinators have a tough time finding, and reaching those kids in an insecure environment can be very complex. And so we really need to understand where the kids are. We need teams that are very competent going out with these vaccines. And then the numbers have come down in Pakistan and Afghanistan. So far this year, we've had 19 cases. So even adding the 2 that we just found in Nigeria, this is by far the lowest year of polio cases ever. And we're getting smarter all the time about how we find the villages, how we reach out to the traditional leaders. Obviously, we're going to need great partnership with the governments in the region, particularly up in the northeast in Borno.
Now, the Bill and Melinda Gates Foundation has supported the campaign for a polio-free world with about $3.5 billion at least. What do you perceive as the organization's biggest accomplishments in eradicating polio?
Well, when this all started, it goes all the way back to 1988, there was a commitment to show that eradication can be done. So having success here is important not just for polio, which is literally reducing millions of kids that would have been paralyzed, but also for building better health systems and showing us how to go after future eradications. So we're very gratified that the case numbers have come down. We've had great partnerships. Although our foundation is a big funder, we have many other very generous funders who've been our partners, and even now as we're facing this new challenge, they're stepping up and asking how they can help out. So we're optimistic that this will become a model, just like smallpox, which is a long time ago, became a model and really drove a lot of new great work in global health.